All right, welcome everybody. It is Health Talk, Community Medical Center. One of my favorite people, Dr. Michael Stewart, joining us here this morning. How are you, sir?
I'm doing great. Good morning. How are you?
Good to see you. You're dressed very cash today.
It's kind of a nice escape to be able to dress a little casual for this.
You don't have your scrubs on, or you don't have a stethoscope or any of that stuff.
No scrubs, no tie, no stethoscope.
A lot of people think escape when they come here, but not not in the way you're thinking.
It's all relative, isn't it?
We just feel like if we could dress in junky clothes, everybody should be able to do that at work.
I appreciate that.
So that's because we're on radio. No one can see us,
Which is a good thing.
Okay, so Dr. Stewart, if you wouldn't mind telling us a little bit about yourself.
Sure. I am a diagnostic radiologist. I work over at Community Medical Center in Advanced Imaging, as well as across Missoula, but I've been here about 25 years. I'm a diagnostic radiologist that specializes in breast cancer and breast imaging. So we've got Breast Cancer Awareness Month, and wanted to just talk about some very important subjects related to that.
Sure. Well, I want to talk about you so tell us about yourself, your family, and how you got to Missoula and all that.
Well, we came here 25 years ago and said, let's try this out for a year or two, and we're still here. Our kids were 3 years old.
Are we still on probation then? Or?
We're still doing good, though.
Okay.
So we fell in love with this location, thought it was an awesome place to raise our children, and have just really enjoyed meeting the people, the community, and just trying to just have a good time here.
Wow, fascinating. So I was curious. I understand you have a grandchild.
I do.
You leveled up.
Boy, I tell you, being a grandparent is not overrated, is what I would have to say. So I've got a 2.5-year-old grandson who's just the light of our eyes, and we're doing our best to spoil him rotten.
Well, that's good. You spoil and you give him back.
Exactly. That's our job as a grandparent.
That's the fun part. All right. Now, I realize it's very important that you're here today because October is Breast Cancer Awareness Month.
Yes.
We have a big team-up game at the University of Montana. This Saturday was going to be wearing pink. Not only the football, but also volleyball and soccer. It'll all be pink.
Yes.
The town will be awash in pink.
I noticed our KGVO logo has changed from maroon to pink. Even.
Amazing. Yeah, I thought maybe they threw it in the wash and it just didn't come out right or something like that.
Someone left bleach in there from the last wash.
So tell us what this month means to you as an oncologist, with what you do.
This is just an amazing month in that women and people that have been related with breast cancer have just made this such a huge month. Of all cancer months, it's probably the most known. But for us, what we want to do is we really want to promote that people need to go out and get screened for breast cancer. Breast cancer affects 1 out of 8 women. That's 13% of women will develop breast cancer during their lives. So everyone either is a breast cancer survivor or is touched by one, is related to one. And it is just such a disease that affects so many people. And it's a disease that we have made significant inroads. If you look at breast cancer mortality or death rate, for the past 20 years, we have diminished that over 30%. So it is a cancer that if we can find it early, if we can perform early detection, we can cure this cancer and allow women that are in the prime of their lives to continue on and just lead a fulfilling life and with their families and community.
Now, as a diagnostician, you're kind of on the front end, right, of finding breast cancer.
That's exactly right. So, our primary tool is still mammography, which is the best way that we can diagnose cancer before someone can feel it. So when someone comes in and gets a mammogram, I'm looking for something very small. I want to find something before someone can feel it, because by the time someone can palpate or feel something, it's usually a lot larger. And the key to this is if I can find a cancer very early, people can have a lumpectomy instead of having a mastectomy. They can avoid chemotherapy. So not only does early detection save people's lives, but it makes their treatment so much better during the disease process.
And so what are you doing? You got some kind of double Doppler radar or something that you place over people, or you put them through a chute and close the door and something whizzes by and finds out what's inside? Or?
Well, that's a great question. So, for most people, if they don't have any symptoms, they come in and they undergo what's called a screening mammogram. Versus a diagnostic mammogram is if you have a lump or have some problem. So for a screening mammogram, you come in, you get your mammogram. It's usually 2 views of each breast. The dose is very low. And then we will look at that. The vast majority of these mammograms are normal. About 5% of them will need to come back for some additional imaging, be that another mammogram view, potentially an ultrasound. And even those people who come back, which is a very stressful process to go through, the vast majority of them do not have to undergo biopsy or cancer.
And the original screening is just X-ray?
Correct. It's an X-ray mammogram, a very low dose type of an X-ray that we've used. And one of the really neat tools we have now is a procedure called 3D mammography or tomosynthesis, and that has made a massive change in that we used to just take 2 images of the breast and the whole breast would be summed in one picture. Well, with the tomography or the 3D, we actually do small sections or slices through the breast, which removes the camouflaging surrounding tissue. That type of mammogram has improved our detection of invasive cancers by over 40%.
Wow.
And at the same time, we're calling fewer people back. It's very rare that we kind of get the double edge of the sword, that we have better cancer detection with fewer recalls or fewer false positives. So it's really made a huge difference in people's lives.
Now, having had breast cancer in our family, I've kept very, very close track of research and the various news items that have come out. There was a time when breast cancer folks came forward and said, okay, everybody over the age of 40 has to get a mammogram every year. And then after a while after that, they said, no, only if there's certain conditions. So where are we right now in that, panoply of telling us how to take care of this?
Unfortunately, for many patients and for primary care doctors, it's a very confusing picture out there. I firmly believe women should get their mammograms starting at age 40 and get them every year. And let me tell you a few reasons why. There are some screening philosophies out there that say get your first mammogram at age 50. Almost 25% of breast cancer occurs in women under age 50. So those are women in very important times of their lives. They've got family, young children. And if you look at women between age 40 and 49, when they die of breast cancer, we lose a lot of years of life. So to me, waiting till age 50 doesn't make any sense. Some people say, well, only if you have risk factors. But one of the frightening statistics out there is that 75% of women who are diagnosed with breast cancer have no family history. They're the first ones in their family. Wow. And I think many people feel that if they don't have a family history, they're protected. And certainly it's good to not have a strong family history, but it's important to know that most people that get breast cancer do not have a family history.
So you were talking, I think it was tomography. Is that the name of the new 3D type
yes,
of?
exactly.
Now, is that an initial screening procedure, or is that something you would do, it's a little bit more intense level up?
And that actually is a very initial screening procedure. So when people come in, this is the procedure that we're doing on them initially. And it, as I said, it has just tremendously changed how we look at things. I'm finding cancers that are the most important cancers, the small invasive cancers, and I'm finding them earlier.
Okay, with that in view, my question is, so you want us to get these screenings every year, and yet the screenings are so much better. Can you give us an explanation as to why we would need one of these tomography screenings every year?
Sure. Again, sometimes these cancers, we never know how aggressive they are. Some of these cancers are slow growing and some of them are very rapidly growing. By getting your screening mammogram every year, if your mammogram is normal 1 year, we're going to catch that cancer early. Whereas if you skip it and go 2 years, I can tell you when people come in and they've skipped their mammogram, and if I tell the lady there's something abnormal, I see in their eyes, what if I would have been here last year? Would it have been smaller? Would I have been able to have had a lumpectomy as opposed to a mastectomy? So coming in every year is still very important because these cancers can appear in the interval between when your prior mammogram was, and we just don't want to give them enough time to grow.
We're going to take a little break. By the way, you're here to take some calls if our listeners would like to ask you some questions.
You bet. I'd be happy to.
Dr. Michael Stewart here. I know that everybody listening out there in our audience this morning either knows someone or has a relative or a friend or themselves has had an experience with breast cancer. So if you have a question, give us a call, 721-1290. Dr. Stewart is here to answer your questions, and no extra charge at this particular point. 721-1290 is our number, and we will be right back. We are back on Health Talk. Dr. Michael Stewart, Community Medical Center, joining us, also from Advanced Imaging. And I'll ask you a question during the break, Dr. Stewart, about it just seems like for 50 years we get hundreds of cards and requests for give to this cancer fund and this cancer fund, and I have been asked many times, why haven't they found what's going on with cancer yet? What's happening with that? And which organizations that you work with that you see these are really legitimate? Let's give until it hurts.
Sure. Well, I think it has been very frustrating for people in that the way to create or to stop cancer has not been discovered. We have figured out how to treat the symptoms. We're trying to diagnose it early. But at this point, we're still in the how can we take care of it once it's occurred. So there's a lot of research occurring, and the how can we
So we have to be reactive, right?
We are reactive. We need to find out a way to be more proactive. But these cancers are there's so much variability within them, even amongst breast cancer, when you include all the different types of lung cancers, colon cancers. There's no magic bullet that works for all of them. So I think that where the research is going is into working on the genetic codes for each of these individual cancers and see what is occurring in the mutation or something that is occurring to change these cells. And I think that eventually we'll be treating cancers more on their genetic composition as opposed to more of what the cell of origin is.
So we cracked the human genome not too long ago.
Yes.
So was that like a light year advance for this pursuit, you think?
It's setting the stage, but I think that at this point, we just have a long way to go. We need a big breakthrough to occur for us, and we're just waiting for that to occur. You know, healthcare dollars are in demand at this day and age. Research dollars are becoming more and more difficult to get to. The wonderful thing is there's groups like the Susan Komen's organization. I mean, if you look at breast cancer organizations, people have rallied around this disease. It is tremendous, the popularity of this month of Breast Cancer Month. Look at this football game coming up. And I just think that this is what it takes. It takes community awareness, and it takes us to come together and work on these things, and eventually we're going to hit it. But until then, we need to just make it best for what we can do for everyone once they have been diagnosed with the disease.
You've been talking about genetic factors. Do you think, I mean, let's cast 20, 50 years into the future, okay? Do you think there may be some time, if research is allowed to continue and grow, that eventually we'll be able to tell in vitro if a child is going to be, have cancer and be able to do something, to fiddle with the gene, if you will, and get rid of that so that they can be cancer-free when they're born?
I think that's on the horizon. I think that those things are available. The issue is going to be is what do we do with the mutations that occur? So we might be able to look at the genome or the genetic composition of someone, but somehow during their lifetime, there are factors that are changing this genetic code and mutating things. So not only do we need to work at the very beginning to get at things that we're predisposed to or genetically set up to, but how can we avoid these mutations? What types of things can we do to prevent our DNA from undergoing that type of injury?
And mutating diseases are always so hard. It's kind of like an arms race, like with the flu.
Exactly right.
It's something we still really haven't got a grip on. Every year we have issues with whether or not we put the right ingredients in the mix. So I was really curious to find out a little bit more about this process because, I also have my grandmother passed away from breast cancer, and that had spread to other parts of her body. But I guess my question was, what's after that first couple stages? We talked about the tomography, which is this new 3D form of screening, but you said that you kind of go even more than that. There's an even more advanced screening. So what's involved there?
Certainly. So if you have an abnormal screening mammogram, or if you have clinical symptoms that might relate to breast cancer, a lump or some redness in your breast or something, when you come back, we will do what we call a diagnostic mammogram, which is a very tailored examination where we will examine this individually and determine what are their appropriate views. We may add an ultrasound into the picture. Occasionally, MRI is used. And one of the nice things, too, is most biopsies today are done through a very, very small incision under local anesthetic, whereas 20, 30 years ago, most of them occurred in the operating room under general anesthesia. So surgery has improved dramatically. Oncology has improved dramatically. One of the nice things is surgeons are pretty much operating mostly on breast cancer now. They're not operating on benign disease. So if you undergo through all this process and unfortunately undergo a biopsy and it comes back positive, when you talk to the surgeon, you're going to hopefully have some options. If you have an early cancer, they're going to talk to you about potential for lumpectomy versus mastectomy. And the surgical field has just advanced dramatically also in this, as has the treatment of disease. So in addition to us finding it early, we're treating it better. Our surgeons are doing a much better job. Our oncologists are doing a better job. So that's one reason 30% reduction of mortality over the past 20 years is there's no cancer we've made those kind of inroads with.
With the advancement in cancer research and treatment, there is still that moment when you tell the woman or the man,
yes,
you have breast cancer. Now, you're not a psychologist, okay?
No.
So, but I'm sure you've had to learn to act like one. So when you, I'm sure that there are different reactions from
Yes.
falling down and crying to, okay, now what do we do? You know what I mean? So what are the reactions that you get from people, and what kind of help can they get in that respect?
That is such an unbelievably hard thing for these people to go through. I mean, they're already very frightened when I walk in the room. It's the hardest part of my job is to look at someone and be honest and tell them, I think you have breast cancer. But one of the things that I truly believe is that one of my jobs is to give these people hope, because there is hope with this disease. So many people think, I've got breast cancer, I need to go write my will and testament, and I'm gone. And it is not the case anymore. There are so many people out there who have beaten this disease. And I try to explain to people, this is going to be a very hard road. This is a road no one wants to undergo, but you can do it. And people find unbelievable strength and power within themselves, be it with their family, their friends, spiritually. There's so much help out there for people. And I do tell people that the silver lining to this is when you are done, you can help someone else walk this journey. And it's a horrible thing for these people. I see them, it looks like the avalanche has just piled down upon them.
Right.
But it is just amazing. And that's one of the things I think that has just been made so much passion for me in this disease, is watching people come from that moment of being overwhelmed and thinking, I can't do this, to doing it, and to then being able to help someone else do the same thing.
All right, we're going to take a break. And again, our phone lines are open. If you'd like to visit with Dr. Stewart, lines are open at 721-1290. He'll only be here for about 6 more minutes. So if you want to get your question answered, now's the time to call. 721-1290. We're coming right back. And we are back on Health Talk. Dr. Michael Stewart joining us. Now, real quick, we only got about 3 minutes. So one of the things you wanted to address is people who have a fear of radiation from getting these tests.
You bet. So there are a lot of fears that come along with mammography, and one of them is the radiation dose associated with it. And it's just important to know the radiation dose is extremely low. So the radiation dose from getting a mammogram is no more than living a year in Missoula. We have radon in the soil. We're at elevation, so the cosmic radiation we get, it's no more than traveling in an airplane. So when I talk to people, I tell them to keep things in perspective. 1 in 10,000 is the potential risk from developing cancer from a mammogram. 1 in 8 women get breast cancer. So we're talking 13% versus 0.0005%. If you look at the risks and benefits, it's pretty easy to look at that. Another of the things that people have is there's a lot of anxiety associated with getting a mammogram, not only of having the procedure done, going through the compression, but also what are the results going to give me later. And so those are the things that if we can just talk to people and say, we know that this is stressful, it creates a lot of anxiety, but preventing cancer and finding cancer early and treating it is way better.
Now, on the payment end, is all insurances, do they cover this now? I mean, with the changes in the Affordable Care Act, did that do anything as far as screening goes, or no?
Well, unfortunately, no. It's still one of our biggest battles. It's fully approved by Medicare and Medicaid, and most third-party payers now pay for it, but not all. So we're really working hard on getting the insurance companies to get on board. I can tell you that by doing this procedure, I'm calling fewer people back. I'm finding cancers early. It is a good bang for your buck.
Wow. All right. So let's, okay, real quick, in a minute, what are some things we can do to keep from getting breast cancer? I mean, just on our activity end.
You bet. So number 1, get your mammograms every year, starting at age 40.
Okay.
Eat healthy. It's very important to have a healthy diet. Certainly obesity and things where estrogen can be created in fat cells, that creates more challenges with breast cancer. Excessive alcohol intake, unfortunately, has an association also with breast cancer. Do your self-exam. Make sure you know what your breast feels like so that if a lump appears or if something changes, you can identify that and get in and be checked.
Great. All right. So how about some contact information for your office and advanced imaging? So if we want to get this started now, people, okay, I got here. Listen to Dr. Stewart. I'm going to do this.
Yes.
So what do we do?
Give us a call. Get a mammogram. All facilities in Missoula do a great job in their mammography. They all have tomography or the 3D. Advanced Imaging's telephone number is 327-3950.
What do you enjoy most about working there at Community?
You know, I love working with my coworkers, and I just enjoy being with these patients and their families and just helping them to negotiate through these things. And for most people, they don't have to face breast cancer. Most people, everything's going to turn out okay. But just trying to help people negotiate through this complex medical world we live in.
Sure. Now that we did the Relay for Life, now it's time for Team Up, right?
You betcha. Let's do it.
All right.
October is Breast Month. Let's go.
Dr. Stewart, thanks for being with us. Really
Thank you.
appreciate it. All right.
Appreciate it.
There you go. That's Health Talk for today. And remember, October is Breast Cancer Awareness Month, so get your mammogram and be sure and come to any of the pink activities that are going on in the next couple of weeks. That's going to do it for Health Talk. Stay with us. Dr. Rob Nadelson is going to be joining us on Talk Back in the next hour.